Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 121. Free market healthcare doesn't work. In this episode, Ali Velshi, a capitalist, explains why a free market healthcare system will never work. Mr. Velshi is from Canada, so he knows how a single-payer healthcare system works. He lives in the United States and was a journalist on CNBC before moving to MSNBC. As you will hear, Velshi says that, quote, "There's no actual free market health system, and that's because no profit-making company would ever choose to willingly insure a sick person or an old person. They just don't do it," end quote. That is a fundamental point to remember when it comes to healthcare. And here is another fundamental point that Velshi makes, quote, "I'm a business guy. I'm a capitalist. If you could show me a system where this actually works, an unadulterated free market system where the market handles it all, I would embrace it. But this is what we in business call a market failure. Worldwide, it has never actually worked," end quote. This segment is taken from The Last Word with Lawrence O'Donnell. A link to the segment is provided in the episode description. The first speaker you will hear is Ali Velshi. The next speaker is Representative Jim Jordan, and the third speaker you will hear is Lawrence O'Donnell. So listen closely as Ali Velshi explains why free market healthcare will never work and corrects other misconceptions about healthcare in the United States.
You know, sir, that in all those countries, all the developed countries that have single-payer systems or universal health care, happiness about health care is actually substantially greater than it is in the United States.
Then why do they all come here? Why do they all come here for treatment?
They don't all come here. Republicans say that all the time. They don't all come here. They don't all come here. People in Canada, people in Norway, people in the United Kingdom, people in Sweden, people in Denmark, they don't all come to the United States for health care. Why do you say that? I grew up in Canada. I live in Canada. My entire family's in Canada. Nobody I know ever came to the United States for health care. I'm sure you have a handful of stories about things like that. It's not actually statistically true.
Joining us now, Ali Velshi, MSNBC anchor and correspondent, covers business and other matters. And Ali, there I was Thursday morning, minding my own business, I thought, watching MSNBC. And you have this exchange that I think cut through more than almost any other interview has done in this season of interviews about this subject. And I just immediately called in here and said, can we get him to stay up late? We got to.
Always my pleasure, Lawrence.
A point you made, having grown up in Canada and knowing that system and looking at this from a global perspective, was to the Republicans has been simply show me one example somewhere in the world that is a free market health insurance, health care system.
There's no, not on this planet, there is no actual free market health system. And that's because no profit-making company would ever choose to willingly insure a sick person or an old person. They just don't do it. So the only way this works is as a risk pool. Now, the only way to cover as many people as you can with a risk pool is to do what most countries, most modern countries have done, and that is a single-payer healthcare system or a fully mandated system, not even Obamacare, one where it's not a penalty. Everybody has to pay into it. That's the only way you get young, healthy people to buy into a system that's actually relatively expensive. And over time, it all evens out. There's no such system. There's no rush for people to come to America where healthcare costs twice as much per person as anywhere else in the developed world. And that's the stuff that I just want to lay bare. I'm a business guy. I'm a capitalist. If you could show me a system where this actually works, an unadulterated free market system where the market handles it all, I would embrace it. But this is what we in business call a market failure.
Exactly.
Worldwide, it has never actually worked. Unless there's someone forcing everybody to get insurance, the private markets won't do it on their own.
Yeah, and even historically, free market economists have agreed that there are places where the market fails, and in those places you need interventions.
Often prisons schools, hospitals, and healthcare.
Education, public education. There are areas where if we left it to the market, too many people would be left out of a necessary public good. This is one of those. And that line about, well, if the Canadian system is so good, why are they always coming here for treatment? To hear you be able to personally answer that was so powerful.
They're not. And again, afterward on Twitter and anecdotally, I checked to say, am I out of touch because I've been living in the United States for a while? And everybody told me the same thing. No. There are dotting the Canadian-U.S. border in places in Washington State and Michigan and upstate New York. There are MRI clinics, X-ray clinics, things like that, where if you don't want to wait to get your MRI and you're prepared to pay cash for it, you can do that. There's no real medical care that Canadians are coming to the United States for. And certainly when it comes to prescription health, it's the other way around. Americans go to Canada, either online or physically, to get their drugs. So it's not a broken system. I'm not arguing that single-payer healthcare systems solve all problems. They certainly don't. But in all of those countries that I named in that clip, outcomes are better. Life expectancy is longer. Preventative health care is a bigger deal, but preventative health care doesn't work in our insurance model. We pay for services rendered. If you're actually going to denude the system of services that need to be rendered, the system falls apart.
This should remove all doubt about free market health care. It is a market failure. It has never worked and never will. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.